Hi, my name is Ann Riat, and I'm a physical therapist at Stewart Memorial Community Hospital in Lake City. October is National Physical Therapy Month, and I wanted to talk to you today about a treatment that physical therapists are able to provide, treating female urinary incontinence. I'm a women's health specialist, and I focus on treating female incontinence. It's a topic that no one really likes to talk about, but we should be talking about it because it's a very common problem. Over 50% of women are affected in some way by urinary incontinence in their lifetime, whether it be mild or severe. It's not just a normal part of aging, nor is it a normal part of life, and your physical therapist can help you. First of all, you need to talk to your medical provider about obtaining a referral to physical therapy. And once you've done that and an appointment is set, we start by doing an evaluation. This includes a detailed medical history, or a history taking by me, of your medical history, of your habits, your diet, your fluid intake, and then a musculoskeletal evaluation, specifically noting the strength and endurance of your pelvic floor muscles. Once I get all this information collected, I can provide or develop a treatment plan specifically targeted to you to help with your problem. One of the tools that we use in treatment of pelvic floor muscles, specifically to help them get stronger, is called perineal biofeedback, and that's what we're going to show you next. A vaginal probe about the size of a tampon is what we use and connect to a computer so that patients can see in real time if they are contracting their pelvic floor muscles correctly. So we have our patient today here, and I'm going to show you on the computer how this actually works. So I would like you to go ahead and tighten your pelvic floor muscles, please. Okay, this is a graph that shows, now relax your pelvic floor. The bottom part shows how the patient is actively using their pelvic floor muscles. The top of the graph shows us if we're using any accessory muscles that we really don't want to use, like abdominals or hip muscles. So once the graph starts over, we will show you the difference. Okay, tighten your pelvic floor, please. So the bottom graph goes up. This patient knows where her pelvic floor muscles are and how to contract them. Please relax your pelvic floor. Now lift your head from the pillow. And you see the top graph going up. You can put your head down. That is showing you that at that point in time she was using her abdominals, which we don't want if she's trying to do a good exercise. Go ahead and tighten your pelvic floor one more time. So again, we're getting nice rise in the pelvic floor without much accessory use of the abdominals. And relax. The biofeedback is really invaluable in teaching a patient to isolate their pelvic floor muscles and to do exercises correctly and effectively. That way, once they leave here, they have the tools to do things correctly at home and get their goals of continence by correct exercise. The biofeedback is also used in training programs of different settings there. And once they learn this, then we move them on to functional exercises, sitting and standing, because that's where we live our life. So we teach them how to utilize those pelvic floor muscles in those positions. If they struggle with leakage when they're going from a sit to stand transfer, that's where we gear exercise towards. If it's bending and lifting, that's also where we try and treat and train the person so that they're continent during those activities. One of the other really important treatment tools we have is bladder training. A lot of people will try and empty their bladder very, very frequently so there's no urine in the bladder, and they end up going to the bathroom all the time. This really sets us up for bad habits because our bladder is supposed to store urine. So once we see that pattern developed by doing something that we call bladder diaries, we can see how often they're toileting, then we look to change those habits. We teach them strategies about how to delay the time in between voids so that they can train their bladder to store urine like it should. We want to train our bladders. We don't want our bladders training us. The other avenue, too, is just some patient education on diet and exercise and fluid intake. Sometimes simple changes in diet, or especially fluid intake and the type of fluid that a person's drinking, can really help with incontinence problems. It's important for you to obtain a referral from your medical provider before you start treatment, and once that's done, treatment is usually done 1 time a week, anywhere from 4 to 6 weeks, sometimes a little longer. So overall, it's really a short course of treatment. Some people achieve continence by the time they're discharged. Other people don't, but they certainly have the tools by that time and feel comfortable exercising on their own until they get those goals met. So please talk to your provider. This is a problem that is treatable. Don't accept it as a normal part of your life. We're here to help you, and I would be happy to do that. Thank you.